Hi, I'm Deborah Thomas.
And I'm Dr. Bob Kennevan.
And today we're going to talk about body contouring.
I have a balloon here as a prop to illustrate something. And when I think of body contouring, I think of two different subject areas. I think of liposuction at the one hand, and at the other hand, I think of removing loose skin. And I put the balloon here because it illustrates what often happens when someone gains a lot of weight and loses it, or when someone is pregnant and really stretches the skin. Just like the skin, a balloon has elastin in it, and so if you stretch it too much, it often never totally returns to the way it was before you put the air in. Same with stretch that occurs in the body. And I just want to use this as a metaphor.
It's kind of like, Dr. Kevin, you know I'm a big fan of the show The Biggest Loser, where very obese people go for 5 months and they lose an enormous amount of weight. And last season's winner, he lost over 200 pounds.
Wow.
And last night I heard on TV that he is now thinking about having plastic surgery to remove some of the excess skin.
Which is really what we're talking about today.
Yeah. Okay.
Good. And we have some questions.
We do. We have some questions we're going to go over. So, you ready for the first one?
Sure.
Okay. So we have a question from Tacoma. And it asks, I have a small area of fat on my abdomen that I can't seem to get rid of. I have been exercising and dieting, yet it will not go away. I'm about 5'6" and 130 pounds. Do you think I'm a candidate for liposuction or tummy tuck?
So this is a great question because it illustrates the main criteria for deciding, and it can't be decided based upon a question like this. You need to do an exam, and the main thing I would need to do is I would need to measure the thickness of the skin in that area and see if it's mainly fat there or if it's mainly loose skin, and that's going to determine what the recommendation would be.
Okay, great. And then our second question is from Puyallup, and it says, can you do liposuction on more than one area? How long does it take to recover from liposuction, and how long does it take to recover from a tummy tuck?
So we often or usually do liposuction in more than one area. It's rare that I have someone with just one area that I do liposuction on. Recovery from liposuction is somewhat easier than tummy tuck, in that many people are about their normal activities at about 3 weeks after liposuction, maybe 4 weeks. All the residual swelling from it doesn't go away until about 8 weeks. Now, a tummy tuck, you need to take at least 10 days off work. And most people return to normal activities after a tummy tuck at about 6 weeks.
Okay, great. Good question. All right, so we have a question from Olympia, and it says, what is the recovery time for liposuction of the outer thighs? And are you able to do this with breast augmentation, or can I have both procedures at the same time?
Right. So I already talked about recovery from tummy tuck, so I'm not going to re-answer that question. The question of whether you can do liposuction and a tummy tuck, or a liposuction and a breast enlargement at the same time, I've often done them together. And so those can be done together. And what was the other part of the question?
Can they be done both at the same time? And then what was the recovery time for liposuction?
Okay, and we talked about that.
Yes, we did. Okay, great. Our next question is from University Place, and it says, what's the difference between having a tummy tuck and or liposuction? How do I know what procedure I need?
Okay. Again, I can't really tell someone that until they come in and I examine them. And I see if they have mainly fat thickness, or if they have mainly loose skin, or if they have both. So it's really based upon an exam. And you probably often can tell from the history. If you've gained a lot of weight, lost a lot of weight, and you have a lot of loose skin down there, it's almost always loose skin. And that tummy tuck is the right answer. It's not uncommon, it's very common for someone to come in there, they have loose skin there, and they think it's fat, and I examine them, and they may have almost no fat present. So that's how we determine it.
Okay, great. Our next question is from Graham. This is a great question. Can I drive myself home after having liposuction?
Recently I found out that someone had attempted to drive themselves home after liposuction. So it's like allowing someone to go home having done too much drinking. And no, you can't. You need someone very reliable that's going to take you home and take care of you. You cannot drive yourself home.
Interesting. Okay. And our last question is, do you do liposuction with a tummy tuck?
Wow. So we do routinely do liposuction of the hips at the time we do a tummy tuck. And we do that because most people need it, and also it helps thin the waist. And so that's done together. We don't want to do too much liposuction at the same time because it may increase a risk. And so we want to minimize the amount of liposuction we do at the same time.
Okay, great. We had some great questions here today.
Yeah.
Is there anything else that you'd like to cover or summarize maybe?
I think I just want to summarize the two key distinctions that we've already talked about. Liposuction responds when someone has fat thickness, and a tummy tuck is usually used when someone has a lot of stretched skin, much like the balloon is stretched when you blow it up too much. Okay?
Well, thank you everyone for joining us today, and we will look forward to seeing you the next time. Thank you.
Thank you.